Hi, everyone. I'm Dr. Alyssa Watson.
And I'm Dr. Katie Berlin.
Thank you so much for joining us in the Veterinary Breakroom. In the Breakroom, these are short conversations where Dr. Katie and I get to just chat informally about relevant topics in veterinary medicine. And this week, we are going to be talking a little bit about treating staff pets in the clinic. And one of the reasons this came up is because actually I have a lot of you, if you listen to the podcast regularly, you might know that I have two little puppies. They're not so little anymore, but I did get a male and a female puppy at the same time. One is 8 months old and the other one is 9 months old. And I have been kind of struggling with when to, have their spay and neuter surgeries. And recently they kind of chose for me because my 9-month-old female came into heat, which I should have been expecting, but I was really hoping both of these dogs were going to be a little bit bigger than they actually are. They're about 70 pounds right now. They are French. One of them is a French Mastiff. She's, a purebred French Mastiff. The other one is half French Mastiff, half like Pit Bull. And so I was really hoping they were going to be like, 100, 120 pound dogs, because that's what I love. I love big dogs. And my previous French Mastiff didn't come into heat until she was, a year or more. And then my Great Dane, same thing. I think I spayed her at 13 months and she had never come into heat yet. So I was thinking I had more time than I did. But Tasha came into heat and I decided that was not something that I wanted to deal with at all. And so I took them in. I luckily, because, I'm still in clinical practice, I was able to secure a surgical suite on short notice. Thank you. Huge shout out to Dr. Stacy Nada, who didn't have many surgeries last week and let me borrow her staff and her surgery suite to go spay and neuter my animals. But it got us really thinking about, what do we do, not just with our own pets, but also with staff pets. I've worked at a lot of places over the years, and everybody kind of has different models of how they handle these things. Dr. Katie, what do you guys do, currently with staff pets? Are they allowed to bring their pet to work? What happens there?
Well, so disclaimer, I am not an associate right now anywhere. So I'm strictly relief when I work in the clinic. And so I've been doing a mix of urgent care and primary care. And so I really don't have a home clinic right now. So I am a client. I am a full-on paying full price vet client when I bring my pets in. So I probably would have been out of luck if I'd been in your situation, because I do have a couple of great friends who are vets in the area and who might have done me a solid, but it would not have probably been a guarantee. So, and I don't even do surgery right now. So kudos to you for like whisking your large breed dog in heat and spaying her yourself. Like there's so many factors there that would have been like not doing that. So anyway, so I can't speak to the clinics where I work now, but I have worked at several clinics in the past, and they, as an associate, and they all had different policies. And I will say also from my time as an assistant before I was a vet, those clinics had different policies too. And I think it's safe to say that they got stricter with staff discounts the longer I was in practice. And I don't know if that's because of what industry standard was doing, or if it was becoming more common to have a crackdown on like giving too many discounts, which we'll talk about in a minute. But definitely there's been a wide range of discounts allowed and allowances for staff bringing their pets, and what kind of notice they need to ask a doctor to look at their pets, or to ask staff to help them with their pets if they are the doctor. So it just really seems to run the gamut.
Yeah, I agree with you. And I think too, I have seen that exact same trend that over my 20 years of practice, like when I first started practicing in the early 2000s, it was me and my boss. It was a tiny little practice. We probably had 5 or 6, staff members. And yeah, it was, you brought your animal in that day. Either my boss or I saw you, generally, fit you in between all of our other appointments. But I would say our staff got some pretty significant priority when it came to their own pets. And it's one thing that I think a lot of people go into this field. I mean, I certainly do. I went into this field, kind of expecting that my own pets would be, top priority and taken care of. So
Hmm.
then as I've gone through practice, just like you, I started to notice more, regimented protocols, things being written into the handbook about, um, what are the, oh, what are the expectations, okay, about when you bring your pet
Yeah.
in, as well as it started to be I have worked at practices where there was considerable friction, unfortunately, about associate veterinarians being asked to treat staff pets for no compensation. And especially if you're working on something like a pro-sal model, which a lot of us are still, when you're working on a pro-sal model, if you're doing something for free for a staff pet when you could be seeing a client, animal, that's really akin to taking money, directly out of your paycheck. So that can be a
Hmm.
tough, thing to
Yeah.
to talk about. And it should at least be, I think it should be something that is brought up, in conversation with the entire staff so that everybody is on the same page about how those things happen. I don't know. What do you think?
Yeah, I totally agree. And I think, like for instance, the last practice I worked at full time had a lot of doctors. We had two offices, multiple doctors. There were always multiple doctors there at any given time. And a lot of times one of them was an owner because there were three veterinarian owners. And I would say often and I'm sure the other associates, although I can't speak for them, felt pressure to examine staff pets even when an owner was present. And we were all paid on ProSal with negative accrual. And it did feel a little bit like I wish somebody would at least have asked me. And like our vet team members do so much for us. There's no doubt that they would stay late to help me with my own pet or like come in, to help me with my own pet. I know this. Like I didn't mind doing it for them, but it did feel a little bit like an unreasonable assumption to have a vet who's paid on production and who gets docked if they don't make their base to take time out of their schedule to see employee pets when, especially when there's an owner in the building who isn't paid that way. So I do feel like it is a conversation that needs to happen. I also think that the conversation needs to happen away from the veterinary team
Mhm.
because it doesn't feel good when you're the associate who's like, hey, this feels unfair, and all the other associates haven't said anything, and then you're perceived to be the one who doesn't care about the team. Like it us needing our breaks and needing to make our base salary and needing to feel like we're not being taken advantage of is a separate issue from whether we care about the team.
Yeah.
So I think that was always felt like a little bit of a sore spot and one that we couldn't really bring up comfortably. It was a crucial conversation that needed to happen for sure.
Yeah, that's a really, really good point. Because just like you said, it is separate. You can absolutely. I'm the same way. I want to help my team. I generally, never have a problem saying, "Oh yeah, bring them on in. I'll take a quick look." I answer phone calls, on the weekend from my team members, when we're not even there, and I do that because I love my team. But at the same time, just like you said, just because you're willing to do it doesn't mean that it should be expected. And it's still
Yeah.
nice to get a little appreciation or a little, to have somebody ask you if it's okay. And I will say over the years, I've just been lucky to work with fantastic, assistants, fantastic technicians, fantastic reception, client service representatives, and they've always been wonderful. And they always start their text with, "Hey, I hate to bother you, but is it okay?"
Totally.
And yeah, and I always tell people the same thing when my friends, I have friends that do the same thing that I'm sure we all do, friends and family that call about their own pets. And I always say the same thing. I'm like, if I didn't want, you to have my number, you wouldn't. You wouldn't have my number.
Yeah. Now, if you're messaging me randomly on Facebook and we haven't talked in 20 years, that's another story.
That's another story. Yep.
Yeah.
Then I just won't reply.
Yeah.
But if you have my personal cell phone number, it's probably because I gave it to you.
Yeah. Yeah. And so here's a question, because I think for me, more than compensation, because we want to talk about discounts, and we'll do that in a few minutes, but more than the compensation aspect of it for me was the time aspect of it. And like our team was super considerate, and like we had a lot of credentialed technicians who could do a lot of stuff on their own, but sometimes you need a vet to look at your pet, and like they would come in and have the pet there all morning and not maybe be anxious to say something because we were so busy. And then lunchtime would come and they'd be like, I have my cat here, like, can you take a look? Or they would say it at the beginning of the morning, and then we would just forget because we got so busy. And then suddenly it's like you finally are done with the morning crush of appointments, and you have 14 callbacks to do and like all this blood work to review, and the afternoon is looking you in the face, and you have to eat and pee, and you're like, oh, I don't want to look at a cat right now. But like you also don't want to let your team member down who's been waiting patiently for their cat's turn. And that was another thing that was sometimes like a tough compromise was, how do we get team pets seen so they're not waiting 8 hours till the end of the day? But like if I see a couple of team pets over the lunch break, then I'm staying later that evening to do my records, and the team member's going home, and that's completely changed the flow of my day. And so definitely I think it's, one way to handle it that we tried a couple of times was to actually put them in the schedule if there was an opening. So if we weren't totally booked, we just put the staff pet in there. But then again, that's an appointment that's not open for a client if they call during that day to be put in there. And then you're missing out on income, and the clinic's missing out on income, and bosses don't like that. So it was hard because you never want the team to feel like their pets are not as high a priority. And I think it always 100% of the time felt that way.
Yeah.
And I don't know clinics who do it differently. Like I don't know how they navigate that, because that was always really tricky.
Yeah, that is tricky. I've never worked at a clinic that has done this, but I have heard of clinics having time set aside, on a every other week or once a month, where it's like, this is staff pet day. And so, if you need, which is fine for preventive care, but not fine if your cat is blocked or, or you have an actual emergency. Right. Yeah. And then, then you're still stuck with all of those same constraints and concerns that you just voiced. You can't really have this conversation, just like you said, without talking also about discounts and how are these things charged? Is the staff charged the same way as a client? Also something that, has changed significantly. And I do probably think that's because of more crackdown and more awareness about all of the different legal ramifications of giving services away to employees, because that's truly considered, a bonus by the IRS in most instances. And there are very, very specific, clear laws about how much you can discount services and products for your employees and not run afoul of these regulations. And so, certainly I'm not an expert on those things, but I know that the way that several of the practices I've worked for over the years have been able to, hopefully offer some sort of benefit for their staff is by offering, like a wellness plan, and then that's worked into their benefits. It's listed as part of their compensation, and so then they're pay taxes on it the way that it's appropriate to, and just make sure that you're not discounting more than, I believe it's 20% is what the IRS
Mhm.
says is kind of the limit. You can't discount things more than 20%. Um, but it's hard and it's confusing. I'll tell you, when I had needed to take my dog in for an emergency and go to our local referral center, they gave me a 30% discount as
Yeah.
a not as an employee, as a professional discount.
Yeah.
And so it's kind of like, well, geez, I can get a bigger discount going somewhere, as a courtesy than I can at my own clinic. That's hard to swallow a little bit.
It is. It is really hard. And like, what is a service worth,
Hmm.
especially if you're providing that service, you know? So if you do an exam on your own pet, an exam at that hospital might be worth $70, but you're doing it yourself. So like, do you have to pay 80% of $70 for an exam you performed yourself, And or can you say, well, I'm donating that time? Like if you're examining a staff pet, can you make the call to donate your time to examine that pet and have the exam be worth zero in that case? Because or not, if the clinic isn't getting paid for it, then technically is that a donated serve? I don't really know how that works, and like I feel like that is also a sore spot because I would not want to pay for my professional time to work on my own pet.
Hmm.
And like that that seems kind of obvious, but I don't think it is in a lot of
Right.
cases. And like you said, the IRS says 20%. So the value of a service or product, you can only discount that 20% for your team. And so if you know, are performing a service on a staff pet and it's $100 worth of service, and they get discounted to $80, and that's it. Like if a bigger discount than that, and they would have to pay taxes on the amount over that $20 that they received off of the product or service. And there's no way to get around that, because if the employer says, well, that's unfair, I'm going to pay those taxes on that so that the employee doesn't have to, because I want to give them this as a benefit, then what the employee is paying in taxes on that extra bonus is also income given to the employee. So it's just like, as an employer, you can't really make it
Hmm.
a tax-free gift over 20%, a
Right.
tax-free discount over 20%. So employers really have their hands tied there. And I think that's something that's really important to understand as an associate or a team member, is that your employer's not being stingy. They just can't give it to you. If they get audited, they're going to get in trouble, and you're going to owe taxes on whatever they've given you. So it just, I think that was something I didn't understand for a long time. And I know the teams did not.
Yeah, I agree with you 100%. And I know that there have been multiple instances over the years where team members have gotten discounts or done things, at practices that are long gone now. Some of them are
Yeah.
closed at this point, that were absolutely illegal.
Totally. Yeah. Completely. 100%. Yeah.
They were really neat things. Like I wish that they could be done. I know for at one of my practices at the Christmas party, and again, this practice is long gone and closed. So if anybody from the IRS is listening, it's over. But they had done, like, at the Christmas party, they had taken little slips of paper and wrote, amounts on them, like $500 or $25. I mean, there was one big one, I think, for like $500, but most were little, 25, $30. And then people chose them, and then they got that as a credit on their account, which I thought was so cool. And everybody
That
loved
is
it.
cool.
It was, yeah, yeah. But I don't think you can do that.
Right. I mean, that's basically a gift card, which I feel
Right.
like is money.
Yep.
So, and
Yep.
there's a trail of it. It's not like
Right.
you're just giving someone an Amazon gift
Yep.
card
Yep.
that no one is tracking. So that's an interesting question, is like, if an employer sort of has like a gift card program,
Mm-hmm.
for their teams. If they want them to have a certain amount of money per year to spend on their pets, can they give them gift cards designated for the clinic and not have that count, as because it doesn't necessarily. Anyway, again, IRS people, lawyers listening, like don't listen. But I just wonder if that would be a way to sort of do it, is like give your so it's not like in the account
Mm-hmm.
already. It's just money coming in that they got from you as a gift card. I don't know. But I do feel like, so I have a friend who was a practice owner for a long time in Canada, and she would talk about this, talking about like she has internal clients and external clients. And internal clients are her team, and that includes the veterinarians, the technicians, the client care team. And like she would view those internal clients as even more important than the external clients, because even if they're getting a discount, they're the ones whose passion and loyalty and belief in your clinic and the clinic culture those things are going to show in everything that they do at
Mm-hmm.
that clinic. And investing in them for a little bit of time, making sure that their pets come first on that day that they're in and not last, and don't get overlooked, like that is one of the most important values she practiced by. And that makes so much sense to me in theory. And then in practice, it just seems like that I could see all these different ways where that just, it just gets, it kind of erodes over time and you're not living up to that expectation. And like so many things we talk about on the break room, it probably comes down to clear communication. Like you said, conversations between management and the team and between the doctors, and the practice owner and practice manager, where it's just like expectations are clear and everybody knows why your clinic policy is the way it is. Easier said than done, though.
Yeah, absolutely. But really important, something important to talk about and think about. And so I'm glad we had this conversation today.
Yeah. And just saying that, like, I'm just remembering how passionate she was when she talked about her team and how important it was to her that their pets come first. And I feel like if I take one thing away from this conversation, it's going to be that memory was unlocked. And I hope that somebody listening too will say like, oh, that is an interesting way to think about it. And like, maybe we need to have the conversation at our hospital.
That's great. Do you have a win of the week this week, Dr. Katie?
I do. Well, I think it's a win because I haven't gotten a notification that like banned from ever coming back. But I had the busiest shift at urgent care last Wednesday before the July 4th holiday. I had the busiest shift I've had since I came back to practice after my hiatus. I mean, we were slammed. For me anyway, we were slammed. I was the only doctor. We had two team members there.
Ooh,
And that's it. So there's no client care team. Like the technician slash assistant team that's all we have. So it was two of them and one of me, and we weren't supposed to turn anything away. And it was the day before a holiday, and it was a lot. And we had a big dog, little dog incident, and I had to put in a drain for the first time in probably 10 years. And the poor technician had to like hold my hand while I was putting in this drain in. It's been so long. Like, I just don't have to do that very much. I had to look up how to do it. And then, everybody was vomiting. Like, everyone was vomiting. We had a heat stroke dog, and it was just like all the things that I don't usually see, because urgent care tends to be pretty straightforward for me so far, or GP. All of the things just like came in, and I lived. And I didn't even hate it. So I feel like that's my win is I had my first really hard shift in a long time, and I feel like for once I was the calm one and we got through it, and everybody who walked in walked out. So I'm going to call that a win.
I think that is awesome. I think that's wonderful. It's a huge win. It's you telling that story about that drain made me remember a story, oh my gosh, from years ago. I mean, this was like 15 years ago. But when I was placing a Penrose drain And I know that there's differing opinions on how you place your Penrose drains, but
Yep.
I was very specifically taught that your Penrose drain needed to be under the skin and only exit one area away from the incision. And I was doing a laceration repair, I think, and I went to, tack the top of my drain. And I always did that blindly. And so I went to tack the top of my drain and I pulled, to make sure that I had caught it, and the drain pulled out. And my technician, the assistant, or she's a licensed tech now. I'm not sure she was at the time. I think she was going to school, but she was so funny. She looked at me and she's like, "You missed." And I was like, well, it's not easy. And she's,
I can't see it in there.
it's blind, and she's like, but the funny thing was, she was like, she's like, I've never seen you miss before. I've seen you do this like 20 times and you've never missed. I was like, well, that made me feel good, I guess, that this is the first time I've missed. I'm like, no, don't. I miss a lot. Don't worry.
Yeah, and if you're gonna miss something, like that's a pretty benign thing to miss.
Yes,
So yeah, that's really funny. Drains
really
are.
fun story.
I feel like drains, I internalized some things that I read over the years where surgeons were like, we really don't like Penrose drains. Like, we really try not to place them. And apart from taking off like a giant lipoma a couple of times or whatever, like I really haven't been faced with the question. And so seeing this poor little dog with like these 2 chomp marks, and all of this dead space, and the poor dog had been I'm just going to tell this story because it was so traumatizing. Like, the poor little dog had been walking with her owner, who was a very elderly, sweet lady. And this big dog ran out at them from a neighbor's house and chomped her. And like the older lady, I mean, she was probably in her 80s.
Oh my
And
God.
she reached down to pull her dog away from this big dog and got chomped too. And so the dog had been walking around all day with 2 holes in her because they spent most of the day at urgent care getting her finger stitched. And the poor lady was on blood. She had really thin skin, and because she was older, and she was like bleeding on her pants. And it was just like, she was so exhausted and traumatized by the time I saw them. And this poor dog was walking around without a limp even. And so we thought she might just have like a puncture. We'll sedate her just because she's painful and shave it up. And then we sedated her, and there were these 2 big holes and this big pocket. And I was like, oh man. So, but this poor lady, there was no question. Like, I tried to get out of putting the drain in. I was like, maybe I won't do it. Like, the surgeons don't like it, like risk of contamination. And the tech was, God love her, the tech was like, I feel like most doctors put a drain in this one. And I was like, I know. And it was like, of course it's no big deal, but I was just like, I just hope that whatever happens to that little dog, like, she heals up okay, because that poor woman needs a win. So
I'm sure she will. We'll all be keeping her in our thoughts.
Yeah. What about you? What's your win?
Yeah, I guess I didn't give a win. I got distracted by my drain story. So you guys already know about my win. My win is that my dogs are now spayed and neutered, and I don't have to think about puppies. And I did, like you said, I did a in-heat spay on a 65-pound dog, but it went smooth. They're not even a week out from surgery, and they are both like completely back to normal. So I'm really happy.
That's great. That is a big win. Yeah, I'm glad. And I'm glad she did this not the day before you were leaving for vacation.
Right. Yes. Yeah. So we dodged a bullet there, and so did our pet sitter. I'm sure is very happy.
Yeah. All right. Well, that's awesome. Congratulations on having big grown-up dogs now.
Thank you. Thank you for sitting down with me today. I always love talking with you, Dr. Katie. And thank you to our audience. And we hope you'll join us next time in the break room.
Bye.
Thanks for joining us in the Veterinary Break Room. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production produced by Alexis Ussery and co-hosted by me, Dr. Alyssa Watson, and Dr. Beth Molleson.